Hi, I'm Alex House, and I'm here with Anna Wyszynski, Director of Psychology at the Optimum Health Clinic. And we thought we'd just do a short video, being January, being the new year, around kind of motivation and making sure you're on track for the new year and kind of moving things forward in the way that you want to. I know that for a lot of people dealing with things like ME, chronic fatigue, fibromyalgia, those kind of things, that January can sometimes be quite a difficult month. You know, it can be a sense of looking back on the previous year and maybe not feeling you've moved forwards in some ways you'd like to. So we thought what we would do is just try and put together a useful kind of short video to kind of be able to really make sure you've got things on track and also see where you're going with what you're doing.
Yeah.
So over to you.
Well, I think the first thing to say is January can be a bit depressing, you know, winter month and all of that as well, but also it's a really good opportunity to review. And I think if you use it as an opportunity to review, that can be really positive and really helpful. So first thing I would say is it's a good time to take a bit of stock, to look at where you're at, what's been going on, but also, I always think the first thing to look at is what has been working. So it's a really good starting point to say, okay, over the last year, last 6 months, whatever it is, if I'm in treatment or if I'm taking a certain approach to my recovery, what's actually been working well? It's one of the things that people often don't do is notice what's working and give themselves credit. Because as human beings, we're far too prone to look at what's not there or not where we want it to be.
In fact, a great example is one of the people was actually on sequence recovery. He was an old patient of Anna's and was actually our first ever operations manager and also kind of a personal friend of mine these days. A guy called Simon. Will you tell them a story about Simon and Snowden?
Well, rather famously, Simon, sorry about this, Simon came to see me and I said, yeah, I haven't seen you for a while, Simon, how are you doing? What's been going on? And he said, well, yeah, you know, so what's happening? How are you feeling? He said, well, I'm all right, but I've had a few symptoms, you know, IBS, not been feeling great. I said, okay, well, you know, that's a shame. What have you been doing? He said, well, it was kind of at the weekend. I said, oh, so what were you doing at the weekend? He said, well, I climbed Snowden. And I sat there and looked at him and thought, you really need to rethink this. There's something very wrong with the way you're focusing it. So
someone who'd been fairly seriously ill for about 5 years at this point.
Exactly, and the ability that, you know, he could climb Snowden at all. He wasn't even noticing that. He was focusing on the fact that, you know, his stomach hadn't felt great.
And so, I think 6 months previously was struggling to do a few hours a day at the office.
Exactly, it was a big jump. He'd done really well.
And I guess it's also in noticing what's working. When you notice that, you can do more of that.
Exactly. It's crazy, but very often the thing that I see most is that patients forget to notice what is good, what does work, so they don't get to be consistent with it. If you know that your yoga's doing brilliant things for you, that, you know, meditating's really helping, that learning to relax or whatever it is that you're doing to work on your nutrition is really making a difference, then just looking at that so you know that those are the things, those are the cornerstones of your recovery that you need in place to keep consistent with.
And I guess the key thing is also not measuring recovery by any particular day. I think the danger can be someone has a really bad day and they go, oh, I'm just not getting better, things just aren't changing.
Yeah.
And I always say that what you're looking for is the actual upward trend.
Yeah, exactly.
And so what we're really trying to look for is good days are better than good days used to be. Bad days are less bad than bad days used to be.
Exactly.
Good periods last longer, bad periods you come out of more quickly. And you have more good periods and less bad periods. I mean, that's the general trend that we're looking for. Yeah. But any one day, depending on how you're feeling, you may measure it completely differently.
Well, it's like in anything, you know, in the economy, in the environment, in any business, you're not going to look at a day and use that as your monitor, you know, your measure. You're going to look at the general trend of what's happening. So the ability to step back, which is why January is good as well, have an overview, to step back and really see what the trends are is really useful. So if you've got an idea of what the trend is, you've seen what's working, those two are really good starting points.
And I guess the next thing then is to look at maybe what's not working. To look at what you could be focused on doing differently.
I think the key thing is then to say, okay, what do I need that isn't currently in place or what doesn't feel like it's quite happening yet for me? You know, what's still missing basically from the mix?
Well, it's almost like, you know, it's a little bit of a cliche in pop psychology, but this idea there's no such thing as failure.
Yeah.
There's only really is information about what isn't working.
Exactly.
You know, I forget the statistic, and people who watch this probably know what it is about Einstein and the light bulb, but it was something like Edison.
Yeah.
Light bulb.
Einstein
light bulbs, but Edison and the light bulb. It was something like 1,009 attempts. You hear different numbers, different places. But I remember one person had said to him, "How does it feel to have failed over 1,000 times to invent the incandescent light bulb?" He said, "Well, I haven't failed 1,000 times. I've found 1,000 ways not to invent the light bulb."
Exactly.
And
along the way, he invented some quite useful things.
Exactly, and that's often on the recovery path, that each time you try something, even if it doesn't work exactly the way you want it to work, what you have is information.
One of the things that I always say to people who come to me is it's not that you come having failed to recover when you start process or when you start work. It's that you've learned a certain set of things. Everyone's got some experiences, some tools, some understandings and insights that are going to be massively helpful. What usually needs to happen is you need to put them together in a consistent fashion to then move forwards from that. So you need to take what you've learned and really apply it. And I think one of the real key things, if we talk about that bit that's missing and what you need more of, is the way that you frame it. So if you go, well, what's not working? Where have I screwed up again? How am I failing? Those are questions which are not really going to get you very useful answers. So it's the ability to say, okay, in a positive way, what do I really actually need at this point? What am I not doing, or what help do I not have at the moment that I need to put in place that will give me that extra percent that's going to take me where I need to be?
And then, of course, once you've got some clarity on what you're doing that's working, what you might want to do differently, it's then, of course, doing something.
It does help.
It's that kind of. I forget the details of the story, but there's a story of someone who wants to win the lottery, and they keep praying to God, I want to win the lottery, please let me win the lottery, I want to win the lottery. And then one day God says, well, can you buy a ticket? It would help.
Exactly.
And not that we're encouraged to buy lottery tickets, but in terms of the recovery path, it's so easy to get caught in the trap of having an idea of what to do, but then not really following through. And I know that there's a real measure from our experience between how consistently people do what they need to do and how much things move forwards. That's not to say you can't overly achieve and push trying to get better. But there's a lot to be said. People are watching this and thinking, that kind of makes sense. I can see things I could do differently. That whatever that then involves, to take some kind of small action, maybe even at the end of watching this video. If you're not a patient at the clinic, maybe it's just ordering an information pack or a free 15-minute chat. Or if you are a patient, using more some of the tools that you've got. Or if there's something else that you're looking at, you have to be with us, but it's taking some kind of action.
And I think it's funny, people sometimes say to me, well, but I'm just lazy, or I can't seem to get myself to do it. And I genuinely do not believe that a human being is lazy. If you believe that something would work, and you believe that you could do it, and I've asked this question to thousands of patients just to check, would you do it? And the answer is always yes. If you genuinely believed you could do it and knew that it would work, would you do it? And of course the answer is yes. So the key is always either your belief in what you're trying to do, or your belief in your own ability to do it. And in either of those cases, you've got to then address that. Look at doing something different, look at your confidence, so that you can then take action and can move forwards.
Sounds good. So hopefully that was helpful for people that are watching. And if you want to explore this more, then, as I mentioned, information pack for 15-minute chats, a great starting point. Hope this was helpful. Look forward to talking with you again soon.